Okay, what I'm going to show here is trimming the lingual section of the mandibular cast. What I need to do this is a straight handpiece of this acrylic burr, which has the wide flutes so that the stone does not plug up the flutes. My mandibular cast, an air chuck to help blow any dust or air away, stone dust away from where I'm working. And this is the area we're going after, this lingual section that's kind of bumped up there. I need to trim that down so it's flat with the rest of the cast. In order to do this, you want your cast to be pretty dry. If it's wet, the stone is going to get stuck everywhere. Now my casts are maybe a little bit wetter than what I'd like them to be, and so you'll see that some of the cast is going to, some of the stone is going to get stuck on the cast. If that happens, you need to make sure you get it rinsed off as quickly as possible. Or don't let it set on there because it'll distort the surface of your cast. So once I get my burr placed in this straight handpiece, I turn on my vacuum suction to suck any dust away, and then I'm just gonna, the objective is just to flatten out this section on the lingual. And when you're doing this on an actual patient's cast, you have to flatten out the entire lingual section, or you have to do it much more oftentimes than what I have here. You can also do some other things to help when you pour up the cast to flatten out that lingual section. In this case, I didn't need to do that because I had captured some of that flat area on the Type-It On. You saw that dust that accumulated there. I'm trying to blow it away to keep it clean, but you'll see that there's still sections, there's still areas where that dust is getting stuck because the stone is just a little bit moist. And when I'm finished, I need to make sure I clean all that off because it will harden just like stone will harden, and it will end up affecting the surface of my cast and make it inaccurate. See that stone that's in between the teeth that's stuck there? No matter how much I blow it off, that's not going to go away. That has to be rinsed off with water. If this cast is really, really dry, that will blow away much easier. Just need to be careful if you're finding that's happening. When you're done, you gotta rinse these off, and maybe even take a toothbrush or a brush and scrub off any extra dust that's there. My goal is to make this really flat and even with the rest of the tooth without damaging the anatomy and marking this soft tissue. Got it about there now. You can still see where I've added that extra stone. And that will always be there. And anytime you add more stone, you can often see little demarcations and lines around the new stone that you added. So I measure this. My goal again was to be about 15 millimeters thick. I estimated I had about 4 extra millimeters of stone back there. I measure this, it's right about at 15 millimeters, I think. I think I'm pretty happy with that. That measurement will give the stone enough thickness to be strong so it won't fracture. I gotta go clean up all this extra stone dust that's left.